Well, good day, everyone, and welcome to Cochrane Canada Live. That is the research webinar series brought to you by the Canadian Cochrane Centre. My name is Adrienne Stevens, and I hope you are having a great day. Before we get started, I just want to take a moment to thank the funding agencies of Cochrane Canada, those being the Canadian Institutes of Health Research, Knowledge Synthesis and Exchange Branch, and to 7 of the institutes connected with CIHR. Thank you for your support during this funding period. And I'd also like to make a special recognition to the Pan American Health Organization, that is the regional office of the WHO for the Americas, to the Research Promotion and Development Division for providing Illuminate Live that makes these webinars possible. And just to orient you briefly before we get started, as you can see, this is the participant window that you should be able to see on your screen. And if you wish to ask a question to one of the speakers today, Lori and Kaelan will indicate when they are ready to take your questions. All you need to do is simply click on this button, as you can see under your participant window, and a queue will form here, and they can answer your question when they're ready. If you wish to send an emoticon through to the speakers, send a happy face or applause, please feel free to do so during the session, and as well you will have a chance to take part in a live poll, and this is where you click your answer, your response during the session when it's time, and we will also provide some instruction at that time for you. And a special feature of today's webinar, we will have the opportunity to see a live demo of the database that they'll be showing to you today, Health Systems Evidence. And I just want to indicate to you that when they are sharing their application during the live demo, this is actually a floating window that will appear on your computer. And so I ask that you simply use your mouse and sort of widen this out so you can have full view. And as they are going through the demo, you may also need to use your bottom and your side scroll bars to be able to see what they are seeing and orienting you during the presentation. And just a reminder of the format of today's webinar, and so through Illuminate Live, when we use the audio function, it's one audio activated at a time, and so when you want to ask your question and they instruct you when they're ready to receive it, if you wish to use your microphone, then simply click on the audio button, as you see down here, and this appears to the bottom left-hand part of your participant view, and simply click on that, ask your question, and then don't forget to push the button again when you are finished so they can come on to answer your question. And so without further ado, what I'd like to do is introduce you to the team of folks who put together Health Systems Evidence. They're from the McMaster Health Forum. And so by way of brief introduction, Lori Greco, she holds a Master of Health Science from the University of Toronto, has had over 15 years of experience in health promotion and knowledge translation. She has held positions in both the research and practice areas of public health in her role as knowledge broker at McMaster University with both health evidence and the policy liaison office of the Canadian Cochrane Centre. Lori's work focuses on improving evidence-informed decision-making in policy and public health environments. To introduce Kaelan Moat, he is currently entering his second year as a PhD student in the Health Policy Program at the Centre for Health Economics and Policy Analysis, that is CHEPA, at the McMaster University, being supervised by Dr. John Lavis. His areas of interest include analyzing the effectiveness of synergistic efforts to link research evidence to health systems policy decisions with an emphasis on low and middle income countries. Kaelan earned a Master of Science degree at the London School of Economics and Political Science in International Health Policy and has worked for NGOs in both Canada and India. And as well to introduce Mike Wilson, who is also part of this team. He recently completed his PhD at McMaster and is a research fellow in the program in policy decision making at McMaster University and a scientist of health policy and knowledge transfer and exchange at the Ontario HIV Treatment Network. Mike's research interests include knowledge transfer and exchange with a focus on health systems managers and policymakers as well as community-based organizations. And so without further ado, please join me in welcoming these folks to the floor.
Well, thank you very much, Adrian. It's Laurie Greco here. Kaelan and I are delighted to have the opportunity to present today. And thanks to all of you for your interest in health systems evidence. Just to make sure that everybody can hear me okay, that my microphone is not either too loud or too low, can I just get a happy face if the audio is okay for everybody? And I'll move on. That's great. Thank you for those responses. So today we're going to tell you about health systems evidence, what it is, how it was created, why we think it'll be helpful to you, and more importantly, how you might use it. So we'll show you the site, take you on a tour of the home interface and the search interface, and do some live demo searches. We hope that you'll feel confident that you can quickly find relevant research evidence on HSE at the end of this presentation. I know that there are a few international participants on the call today, so we just wanted to welcome you and thought you might be interested to know that McMaster University is in Hamilton, Ontario, in the province of Ontario in Canada. And Hamilton is about an hour west of Toronto on Lake Ontario in southern Ontario. We'd like to acknowledge Health Systems Evidence partners. Health Systems Evidence is a component of the McMaster Health Forum, which is a program of stakeholder dialogues, and I'd be happy to provide more information on that if there is interest. McMaster University's Program in Policy Decision Making is a program which identifies and codes reviews about health systems arrangements. The Canadian Cochrane Centre, particularly the Policy Liaison Office, supports the use of syntheses and health systems evidence in particular by health system managers and policymakers. And RX for Change is a program which identifies and codes reviews about implementation strategies. So at this point, we'd like to get a sense of the role of the participants on the call. So I'll just toss it over to Adrian for a second here.
Okay, thanks, Laurie. And so underneath your participant window, you should see a few selections. And so, yes, they are curious. What is your role? Are you a clinician? Are you a researcher? Are you a manager or administrator? Or do you fall under another category? So you can go ahead, cast your vote now. And what will happen is when you make your selection underneath the window, you won't see anything happen with the interface. All Illuminate does is it simply receives your response. So I'll just give you another minute to make your selection. And then I can publish the aggregate results to the whiteboard. Okay, that's great. We have quite a few responses coming through. I'll just wait one other minute, and I'll publish the results to the whiteboard, and I'll hand things back over to Laurie.
Thank you very much, Adrian. So it looks like we've got about half of the room is researchers, a few managers and administrators, and some other categories. So that's interesting. We'd love to know what your role is if you are in the other category. So thank you for those responses. So the background for this presentation, the work to create health systems evidence came out of Dr. John Lavis's research program at McMaster to promote the use of research evidence in policymaking and management. So a systematic review was conducted and to determine the need for a policy-relevant research repository. So two factors emerged from this research with some consistency. The first was engage policymakers more, so interactions between researchers and policymakers. So our strategy at the Policy Liaison Office is to engage policymakers in priority setting, research, and deliberative dialogues. The second factor that came up very consistently was timing or timeliness. So the ability to very quickly facilitate the retrieval of appropriately packaged, high-quality, highly relevant systematic reviews and policy briefs. So this is what health system evidence is, and I hope that you'll see that in just a moment. We'd like to acknowledge our colleague Mike Wilson as well, who was instrumental in developing the taxonomy on which the registry is based and is responsible, along with Kaelan Moat, for ensuring its content and quality. So what is health systems evidence? It was developed specifically with policymakers and managers in mind in order to save time and enable ready access to research evidence. It is newly redesigned and now continuously updated, a repository of syntheses of research evidence. And you'll see that it's got expanded search capacity, which I'll talk more about in a few minutes. So health systems evidence contains only synthesized research evidence. So the work has been done by the researchers to find and synthesize, pull together in one place, policy-relevant research studies. And the team at the Health Systems Evidence has identified and pulled all of those syntheses together in one place, and we think organized them in a way that makes it really easy for you to find them quickly. So Health Systems Evidence contains review-level, policy-relevant evidence about governance, financial, and delivery arrangements, so that's what works in health systems, and implementation strategies. So that's about why and how it works. So we've got another interactive question here, and I'll just talk back to Adrian for a second.
Okay, thanks, Lori. And so the question posed to you is, given what you know so far, are you likely to use health systems evidence to find synthesized research evidence about governance, financial and delivery arrangements within health systems, and about implementation strategies within health systems? And so yes, go ahead, cast your vote now. Yes is A, no is B, and C is maybe. And I'll just give you another minute to think about the question, cast your vote. And once again, your options are shown below the participant window. And once you make your selection, it comes through Eliminate to us. And great, I will publish the aggregate results to the whiteboard and hand it back to Lori.
Very much, Adrian, and thank you for those responses. I'm very happy to see that there are no Bs selected at this point. So now we're going to hand it over to Kaelan, who's going to talk to you about the background and the development of health systems evidence. Kaelan?
Thanks, Lori. I'd just like to do a similar sound check to make sure I'm coming through loud and clear and not muffled at all, so if I could get some happy faces up, or great. So I'm going to get into how we build and maintain health systems evidence, so the behind the scenes of what goes on here at the program of policy decision making, to make sure that we're constantly updating and ensuring the quality of the contained records. So building and maintaining health systems evidence is an ongoing process of identifying and screening abstracts of systematic reviews and other types of research syntheses for inclusion. We also code each included synthesis according to the type and how it addresses specific health systems arrangements and implementation strategies. And we also find links to the free online PDFs where available, also full text files and the scientific abstracts. After all of this is finished, we also apply the AmStar rating tool, which is a quality rating tool to produce a methodological quality score for each synthesis that the tool is applicable to. And then we also identify the countries in which each study was conducted that's contained in the review. So the process of identifying abstracts and research syntheses. So as we all know, research syntheses, specifically systematic reviews, are published in a wide range of sources. So we try and reflect that in our search strategy for these abstracts that might be relevant. And we do regular checks of both the database of abstracts and reviews of effects, so DARE, that's held at York University, and these now come out weekly. So weekly we do check the updates coming from here, and we also check every Cochrane Library of Systematic Review updates, so that comes out once a month. Just to double check and make sure we've caught everything that might be relevant to health systems, we do a double check often for the EPOC group. And we also maintain relationships with people who forward us syntheses that may be of interest, and also from personal knowledge. If we come across something from a listserv that seems relevant, we put it in the stack of things to be reviewed. So the process of screening the abstracts and other syntheses for inclusion, just generally speaking, our inclusion criteria for review, so what we define as a review, at least 2 databases have to have been searched and mentioned within the text of the article, and there also must be an explicit inclusion and exclusion criteria included in the text. For policy briefs, this is a term thrown around quite a bit these days in different capacities, but at Health Systems Evidence we define policy briefs as a synthesis that addresses 2 or more of policy problems, options for addressing the problem, and implementation strategies. and they also must draw, at least in part, on systematic reviews to describe what is known about each of these for 2 of the 3 that I mentioned before. So that's our inclusion criteria for a policy brief. For overviews of reviews, it's a similar criteria to that of reviews. And this process is performed independently by at least 2 reviewers. So we get the updates from places like Dare and Cochrane, and we scan the abstracts, decide whether or not the syntheses included should be included in HSE, and then we get together and consolidate our ratings. So coding takes place after we've identified separately which reviews should be included, and we code them based on whether they're a policy brief, overview, systematic review. Protocols we code as well, so you're able to search the database specifically on the type of synthesis it is. Also, what kinds of question the synthesis addresses. So reviews of effectiveness are coded as reviews of effectiveness, and policy briefs generally, which target a few different kinds of questions. So those are usually coded as questions that address many different types of questions. And then, as Laurie mentioned before, we also code based on which health system arrangement or implementation strategy they address. So these can be grouped into things like governance arrangements, which might deal with issues about centralization or decentralization of policy authority. Another example of the coding structure is financial arrangements. And this is a good example of something like fee-for-service as a form of remuneration for physicians. Delivery arrangements is another taxonomy code that we have. And an example of the delivery arrangement would be the substitution of nurse practitioners for general physicians in primary care. And as Laura mentioned also, that we code syntheses for implementation strategies. And an example of this would be providing consumers with information or education about a program. And this process, as I mentioned before, is also independently coded by 2 reviewers who then reconcile. So this is just a general, just to show everyone here about the subheadings of the code. So the major taxonomy categories I mentioned were governance arrangement, financial arrangement, and delivery arrangement. Underneath each of these are subheadings. In parentheses, you can see how many reviews are contained under each subheading. And these are by no means mutually exclusive. So if we find a synthesis that addresses organizational authority questions and also addresses a question about remunerating physicians, they will be coded as both. And here's an expanded category. So under implementation strategies, some of the subheadings would be consumer-targeted strategies and provider-targeted. And you can see that under each of these subheadings, there are even more subheadings which go into more specific details about what kinds of consumer-targeted strategies, for instance, or what kinds of provider-targeted strategies are addressed in the review. So after we've finished the coding, so we've identified the reviews, we've coded them, we've reconciled these codes, we have someone here at the Program and Policy Decision Making searching for all of the records, whether or not they're publicly available, free copies of the PDF files, and we also link all of the records to any user-friendly summaries that we find available. So we scanned the Center for Reviews and Dissemination, so the DARE database and the Center for Reviews and Dissemination has user-friendly summaries of all of the abstracts that they put out. And we also searched the Australasia Cochrane Center for Policy Liaison. And so for any of these user-friendly summaries that are available for any syntheses that we identify, we make those links readily available and link them up to each record in the database. And finally, as I mentioned in the overview, we apply the ANSTAR rating tool to any systematic review to assess its methodological quality, and that score is provided along with the records in a retrieve search. And additionally, we do country coding, so that means we go into the review and assess which countries we're actually focused on in the included studies in the review. And both of these bits of information are also available in the retrieve searches. So I'll pass it back over to Lori.
Thanks, Kaelan. So just to summarize why we think you might use health systems evidence and how it can help you find research evidence when you need it. So key features, again, is that it gathers policy-relevant research evidence into one place. So you've got synthesized evidence that's prepared in a systematic and transparent way. Details on those syntheses you can find are how recently the search for studies was conducted, what the quality of the synthesis is, where it's available, the countries in which the studies and the synthesis were conducted, and key findings from the synthesis. And you'll find this on the summary, which you'll see more about in just a second. So again, a summary of what is in health systems evidence. The types of syntheses are policy briefs, overviews, systematic reviews. There's also systematic review protocols, which will give you a sense of research that's coming down the line on any particular topic. And again, links to summaries, abstracts, and full text reports that are currently available. So at this point, there are over 1,300 and some 60 records in health systems evidence, 17 of which are policy briefs, 15 are overviews of systematic reviews, over 880 systematic reviews, almost 300 of which are Cochrane reviews, and 154 protocols for Cochrane reviews. Another key feature of health systems evidence is the evidence service. So these are subscribable monthly updates on new records added to health systems evidence. So very soon, hopefully late in 2010, we'll have a general evidence service which will include a monthly update of anything new that's been added to health systems evidence. And there are currently available topic-specific evidence services under the topics of primary health care, chronic disease management, diabetes management, chronic pain management, and rural healthcare strategy. And these topics link directly to stakeholder dialogues that were held through the McMaster Health Forum. And the evidence service is a year-long service that follows that stakeholder dialogue program. It's part of the program of stakeholder dialogues. And you can find more information, all of the archived evidence services, and an option to subscribe to the evidence services at this URL provided here below. You can just go to mcmasterhealthforum.org, and there is a link on the home page there to the evidence services. So again, what's in health systems evidence? For those of you who might have been familiar with the Program and Policy Decision Making Canadian Cochrane Network and Center, or the PPD CCNC database, which is the former incarnation of health systems evidence. We've spent the last probably year and a half developing HSE, which replaces the PPD database. So health systems evidence, new information and options and functionality include lots of additional information about each record and many more additional options for searching, which you'll see in a moment. And this is just a summary of the ways in which you can search for synthesized evidence on health systems evidence, which we'll demonstrate in a second, so I won't go through this in detail at this point. Once you've done that search, what will you find? What are the details of each of the records you'll find on health systems evidence? Information about the type of synthesis it is. So is it a policy brief? What kind of question is it asking? Is it about effectiveness, or is it about not effectiveness? That would be things like stakeholder views and experiences. What topic does it address? And again, the title, when the literature was searched, what the quality rating is, what countries are included that you might, understand that would make that review applicable to your context, and then links to any review-derived products. So at this point, we're going to link online to health systems evidence, and we're going to show you what the home page looks like. So again, as Adrian mentioned a little earlier, once you see the health systems evidence homepage come up on your screen, you can just drag it to the center of your monitor and widen the screen that you can see the whole of the home page on your screen in front of you. So just let us know if everybody's able to do that, and if you have any questions, certainly send them through to the chat window for us. So here you see the home page. At the very top of the home page is information about the development and content of health systems evidence. So you'll see some links to information about why use it and who's behind it. Lots of tips about what's in it and how the evidence is organized. And then on the right-hand side, extensive information about how to search health systems evidence and what a search will retrieve. And scrolling down the page a little bit, this is the main search interface of health systems evidence. So at the top of that interface is the option to search by health system topic. So the way the topics are organized in health systems evidence, Kaelan talked about this before. The overall categories are governance, financial, and delivery arrangements within health systems, and implementation strategies within health systems. You click on the plus sign. Each of these major categories is expandable, includes subcategories, and many of the subcategories further include more subcategories. So it's really helpful in the very beginning when you're using health systems evidence, I think, to just expand all of the categories and get a good sense of how the records are organized within health systems evidence. We all found that the more we used it, the more we were familiar with how the records are organized, and the quicker we could find the types of reviews that we were looking for. So you can click, for example, on policy authority. Again, the parentheses indicate the number of reviews that can be found under that category. And again, this is further subdivided into centralization, stewardship, coverage, corruption, and so on. Corruption protections, I should say. So you can see in brackets the number of reviews that are under each of those categories. Scrolling down the page a little bit, I should say before I move on that you can click on several of these categories and subcategories. This will obviously yield a larger and more diverse set of syntheses. So scrolling down the page is a little bit more about the ways you can search health systems evidence. Here are the Canadian priority areas. These were identified in the 2003-2004 federal provincial health accords and through Listening for Direction 3, which was a national priority setting consultation. Again, you could click on the plus signs to show additional subcategories, which may include, for example, under national priority funding area, primary health care, for example. And again, the number of brackets indicates the number of syntheses within a subcategory. At this point, I'd just like to ask you if there are practice or research questions that you can see already that you might search health systems evidence for. Topic areas, practice areas, research areas. If you want to post those to the chat room, that would be very interesting for us to know and will help us develop sample searches that we might do in future webinars. So thank you for some feedback on that. A little bit farther down, the next option for searching is the type of synthesis. So again, policy brief overview, Cochrane systematic review, and protocol. So the default option will always be to search for all types of syntheses, but you can hold down the Control Command button and simultaneously highlight additional type or types of syntheses to search for. Again, another option is to search for the type of question you're asking. So this might be many, as in a policy brief, or you might just search for effectiveness review, so what works for a particular strategy. You might search for reviews of non-effectiveness, so this would be things like views and experiences of stakeholders, or why and how a particular policy or program would work. Again, the default is to search for all types of questions, and you can highlight a given type of question to narrow your search, or hold down Control Command to simultaneously highlight a second type of question. You may also search for the synthesis author or authors by entering surname or surnames. If two or more are known, you can enter all of the surnames in the search field. The default will search for any of those authors, but if you want to search for all of the authors, that'll help narrow your search.
So an open search allows for any words to be entered, for example, a clinical condition such as HIV/AIDS, or a program or service used to treat the condition, or a sector such as home care. The default option here is to search for any of the words. If more than one word is entered, you can click on the option All Words to require that all of the words be present. You can click on Exact Phrase to require that any of the words be present with the exact spelling and order in which they were entered. And finally, you can click on Words with Logic to use Boolean operators and, or, and not to further focus the search. And combining a search of health systems topics or Canadian priority areas along with an open search for a particular content domain such as HIV/AIDS or home care can help to determine whether a particular health system topic has ever been examined in a particular health condition or domain area.
You can search for a range of years to limit the search to the time frame in which you are interested. So for example, you might want to search for 2005 to 2010 to limit your search to more recently published reviews or records that were more recently published. And finally, you can search for how recently the record was added to health systems evidence. So again, the default is to search for all updates, search through all updates, but you can search for the last update, the last two, or the last three updates. And again, the last update will give you records added in the last month, the last two in the last 2 months, and so on. So at this point, we're going to close the health systems evidence window for a moment and go back to our slides. A tip on searching for health systems evidence, we think it's really helpful to think about the kind of information you're looking for. So ask yourself questions about what is the problem that I'm addressing. So how big is the problem, who's affected, stakeholders' views or experiences about that problem. Then about the options to address that problem. So what you want to do about the problem. So this could include things like the benefits of various program options, negative effects of these options, cost effectiveness, local adaptability or applicability of the problem to your context, or stakeholders' views. So this might help you determine, for example, whether you're searching for effectiveness review. So if you're looking for benefits of program options, you're probably going to be looking for effectiveness studies. If you're looking for stakeholder views and experiences, you're looking for not effectiveness. So reviews that address different types of questions. And again, think about options to implement these options that may address the problem. So what are barriers to implementation? So again, here you're looking at observational studies, so not necessarily effectiveness studies, or the effects of targeted implementation strategies, in which case you are looking for effectiveness studies. So we think that it's helpful to think through each of these aspects of what you want to find on health systems evidence to help you target your search and get a more precise and focused result set. So we're now going to go back to health systems evidence and do some live demonstration searches on the site. So this is our first scenario. So imagine that you wanted to find out evidence about the effect of role substitution in primary care on patient outcomes and resource utilization. So I'm going to pass it back to Kaelan, who's going to go back live onto the site and do some sample searches. Thanks, Kaelan.
Thanks, Lori. I'm just going to check in again and would like to see some happy faces if everyone can hear me. Great. So I'm going to open up health systems evidence. And hopefully it will be working for me. So again, like Lori's presentation, it's going to be popping up in an expandable window, so if you could go and expand the window if need be. And also I'd like to see some happy faces if everyone can see the health systems evidence. Great. Okay. So I'm going to start off with a really simple search. So an example that Lori just gave about a searchable topic would be you're interested in finding what evidence is available about the role of substitution in primary care and patient outcomes. So using health systems evidence, you have a few search options. So I'm going to start off with the basic and discuss how you can search using the health systems topics. And this is a really quick and rapid way to identify reviews that relate to your particular question. However, in order to identify what health system topic you're talking about, as Lori mentioned in her previous slides, it's really helpful to think about what the problem is and what options are available to address that problem. So I've already decided that I'm interested in substitution. So keep in mind, again, that the more you use the taxonomy, the more you'll become familiar with it. For this particular question about the role of substitution in primary care, we've coded this under health system topics as a question that deals with delivery arrangement and also by whom care is provided. So if I go to delivery arrangement, you'll see how I've expanded the delivery arrangement. And one of the subheadings is by whom care is provided. So this is generally talking about health human resources and people who deliver care in the health system. I can expand this by whom care is provided subcategory. And you'll notice as I scroll down that one of the subcategories is skill mix substitution. Because I'm interested in assessing the role of substitution, I would click off that subcategory. Keep in mind as well that if you decide to check one of the higher boxes as the higher subcategories, so in this instance by whom care is provided, you're going to get results from all of those 556, whereas if you go down into the subcategory, you'll notice how under skill mix and substitution there's only 96 available records in the database. So it's a very efficient way to really narrow down your search, but again, it really helps to know what your question is and the problem you're trying to find an option about. So further down here, I've clicked off skill mix substitution because that's the question I'm interested in. And I'm also interested in how this affects primary care. Under national priority funding areas, we have a primary care box, and you'll see I've expanded the national priority funding area, and one of them is primary health care. So again, I'm going to truncate my search to only include those skill mix substitution questions that deal with primary care. And I'm interested in outcomes, so I would only want to look at reviews of effects. So what I'm going to do is click off systematic reviews, both Cochrane and non-Cochrane reviews. And my type of question is effectiveness, so I'm going to highlight that. Now somebody asked a question about open search, and what open search means is that we're not specifying any further the records we're trying to identify in health systems evidence. So an example of trying to truncate with open search now, if we're only interested in nursing in primary care or the role of nurses in substituting nurses for GPs, we might want to use the open search field to truncate the search further by type of healthcare professional. So in this instance, we might type in nurses or nurse into the open search, and that would further focus our search. But I'm going to leave it open for now and go down and search. So you can see, I'd like to see some happy faces if everyone has the search results up now. Great. So you can see that 17 results came up from this particular search. And we have one review that looks very, very relevant to my question, and that is I think it's the fourth one down, and it's a Cochrane review. It's called The Substitution of Doctors by Nurses in Primary Care. So this directly deals with the question I was interested in. So what I'm going to do now is show you all of the work we did behind the scenes to make this record extremely accessible to you. You can go to Show Links on the right-hand side here. And once you click on that, you'll see the expanded categories pop up. And unfortunately, there's no free text report available because it's a Cochrane review and some countries don't have a subscription nationally. But you can see that we have 3 sources of user-friendly summaries. So one of the examples is the database of reviews of effects, and that's a 1-page full summary of the review. So all of the outcomes and a quick way for someone like a policymaker or manager to access information about what the review found. And also for anyone who wants to inquire further and actually gain access to the full record, they can do so through the scientific abstract. So that's just one example of a search that we can conduct in health systems evidence. I'm going to return to the search interface and do a more focused question now. And so this question is something that came up from some previous presentations we've given on health systems evidence, where, much like yourselves, we asked the participants and people listening to send in ideas for what they might be searching the database for. And a lot of the times it's a broad category. So, for example, nursing delivery is something somebody sent us, and patient and provider education is something somebody sent us. Now, although those are very specific things within health systems, using this database, you could find those quite easily. However, as we keep reiterating, thinking about what the problem is and what options specifically you're looking at will help you truncate and use the search function a lot more efficiently. So I'm going to just kind of bounce off of this patient and provider education category that somebody gave us as a topic area they might be interested in searching last time. So a hypothetical situation, I'm going to just put it on its head and make a hypothetical policy situation where discussions around the best ways to improve the quality of diabetes care have resulted in a suggestion that educating providers about best practices and unique strategies to ensure effective implementation of treatment might be a good option to consider. So you decide to look for evidence to support the option. So the option here is that if we provide providers with education about best practices, it will improve diabetes care. So the question that comes out of this hypothetical situation would be, are provider-targeted education strategies effective in improving the quality of diabetes care? So using this kind of thinking to do a search, I'll show you how quickly and efficiently you can use the category subheadings and all of the search interface tools to quickly identify relevant reviews. So provider education would fall under implementation strategies, and again, the more you use the taxonomy, the more second nature it becomes and easier it becomes. And because I mentioned in the question that I'm interested in provider-targeted education, I would expand the provider-targeted subcategory here. And because I haven't specified what kind of education I'm interested in, I'm going to click off every subcategory that deals with education. So educational materials, educational meetings, and educational outreach visits. Now, as an open search, I've run this search before, it would yield 121 results. And although some people might have time to read through the titles and click on the expanded links and look at the one-page reports for all 121 or any they deem relevant out of the 121, the timeliness factor might play a huge part in a lot of people's day-to-day. So there is a way to truncate the search even further because 121 for some people might be a little bit burdensome. So using the open search field, as I mentioned before, I'm typing the word diabetes because I'm only interested in the way that educational strategies targeted at physicians or providers of care would be relevant to diabetes care. So if I type in diabetes in itself, I've run this search before, and this would yield 21. So you're narrowing down by about 100 just by adding in this search term, which helps to focus the search. So I'm only interested in reviews of effectiveness. I could even focus the search even further. And this brings me to 19 results, which is quite reasonable amount to look through the titles and show the links to see if any of these are relevant to the question you're looking for. So for my specific question, there are a few which I might be extremely interested in. One of them could be interprofessional education, effects on professional practice and healthcare outcomes. So we can see here that there are several reviews. That could be relevant to the search. And again, if I decided I was interested in prevention of foot ulcers in diabetes patients through education implementation strategies, I could show the links. And unfortunately, this review doesn't have any. I'll just give you an idea of what a one-page summary would look like. So this is from the database of abstracts and reviews of effects. And the one-page summary of the findings of the review for quick access to what the review is trying to say about your specific question. Okay, so we have about 14 or 15 minutes left, and I'm going to pass it back to Lori. And I hope the search examples have helped everyone, but again, we're open for questions if anyone has any questions. Thank you.
Great, thank you very much, Kaelan. Again, can I just double check my audio is okay? Perfect, thank you. So, next steps for health systems evidence. We continue to improve functionality. We obviously continue to add search for and add records to health systems evidence. And the ongoing monthly updates will continue. And as I said, a general evidence service will be available later this year that you can subscribe to receive notification of all new records added to health systems evidence. New topic-specific bulletins will be added as new stakeholder dialogues happen. So again, through McMaster Health Forum, there are a program of stakeholder deliberative dialogues, and the evidence service will follow for 1 year for each of those identified priority areas. We hope to have soon tutorials on the content and use of health systems evidence, similar to what we've done today. This webinar series is part of our work to promote and train people or guide people in using health systems evidence. So if there's anybody who's interested in, maybe a more specific or more tailored demonstration for your particular organization or your particular area of focus, we might be able to do that kind of thing, so you can certainly get in touch with me about that. We can also address particular questions. So if you've got a question that you want to very quickly find synthesized research evidence about, we can support you in that work, either just through, some quick online support or demonstration for your team, or by doing sort of rapid reviews or evidence inventories for you. So again, you can get in touch with me if you have any of those questions. We have one more question that we'd like to ask you. I'll toss it back to Adrienne for this for a second.
Okay, thanks, Lori. And so for the fourth question for today, given what you know, are you likely to use health systems evidence to find synthesized research evidence about governance, financial, and delivery arrangements within health systems, and about implementation strategies within health systems? So yes, go ahead, cast your vote. If you say yes, you can select A. If you say no, you can select B, and maybe is option C. And I'll just give you another moment. Once again, your options are available just below the participant window, and as soon as you make your selection, it comes through to me on Illuminate. Okay, and so why don't I just publish the aggregate results to the whiteboard for Lori, and I will pass the microphone back.
Thank you very much for those responses. I'm very happy to see that there are lots of A's selected, and I hope that today we've given you a sense of what's in health systems evidence and how it might be useful to you, and how you might use the search interface to quickly find synthesized research evidence that focuses on your area of interest, area of practice. So at this point, we'd like to open it up. If you have any questions for us, we'd be happy to try to answer them. I see that there's one comment posted here on the chat room, and the comment is, could be useful to allow searches to be limited to full text documents. That's a great comment. Thank you for that feedback. As I mentioned, we continue to gather feedback and work to improve the functionality of the search interface, and that's a really great suggestion. So we'll put that on our wish list, and maybe you'll see that functionality appear in the near future. So thank you very much for that question. Any other questions that anybody would like to ask? We'd be happy to try to answer them. Oh, here's another question. Please say again, what was the old name of this project? This program is still within the program and policy decision making at McMaster University, and this particular repository used to be called the Program and Policy Decision Making Canadian Cochrane Network and Center Database. So the PPD CCNC database, it's now called Health Systems Evidence. So at the time, I think it was about 8 months ago, that we began to migrate to the Health Systems Evidence interface. And I believe the PPD CCNC interface is no longer live. I'll try to address some of these questions, and I'll pass over to Kaelan if they're more content related. Share our experience in developing the database, including the cost. So I think this probably has to do with the number of staff and how many people it takes to develop and maintain the database. So I'll toss this one over to Kaelan. Thanks, Kaelan.
Great, thanks for your questions. The issue about cost really deals with how much time it takes to identify code and then enter all of these records into the database, including country coding and star rating and searching the internet for user-friendly summaries. It's quite resource intensive in that it takes quite a bit of time for people to go through each update from Cochrane or DARE, read through the abstracts, identify which ones are in or out, and then the ones that are in, going through the entire taxonomy, which is extremely extensive, as you've probably realized by now, to code those. And then because we do it in duplicate, it takes even longer. So for any given review, the amount of work that goes into one review, I would say, is probably on aggregate about an hour. So, or sometimes more, depending on how extensive the review is and what kinds of publicly available resources are available for us to get the review. So it's quite time intensive. I don't know the exact cause. I do know that right now there are 2 of us working on about 20 hours total a week on this, and then another undergraduate student who is helping us as well for 10 hours a week. So that's just a rough ballpark figure of what it takes just to keep up with the updates and make sure that we have reviews and updates ready each month for HSE. With the country coding and the quality rating, as you'll notice if you go through the database, not every single review in the database has a quality rating or country coding yet, because that is another very time-intensive process, which we generally try and get caught up on in the summer months, and we're working into our budget now how to address that now. But it is very cost and time-intensive. And I also saw another question here about the URL, and I think that's been addressed. So it's www.healthsystemesevidence.org. And I'll take on the country limiting specific countries. So generally speaking, the search is geared towards specific countries. You can't do that on the search interface. The reason that we've developed this country coding process as part of the HSE is to ensure that once a record is identified in the database, people can assess whether or not that particular review or the findings from that review are relevant to their particular context. So if somebody is in the UK and finds a review that has no studies that have been undertaken in the UK, but 15 in Canada, 2 in the US, then they might have an idea of whether or not the issue they're dealing with is similar in the UK, or whether it's extremely different and they can't apply the findings of that review. So the country coding there is to help people gauge whether or not the findings are locally relevant. And I'll pass it back to Lori.
Kaelan. Another question has come in about which fields the open search searches. My understanding is that when you type something into the open search field, you do search the full text of the records in health systems evidence. But Kaelan, can you just confirm that for me?
Right. So the open search function itself, if you ran an open search without clicking off any boxes, you would get every single record in the database. So you generate well over 1,300 records from the database. The open search from the point where you start to check off the boxes in the subcategories of the taxonomy would generate every single review that has that coding to it. So for instance, if you checked off the delivery arrangements, and I think right now we're at 1,102 records under delivery arrangements, and then you typed in, and then you just use an open search without trying to focus any further, then you get 1,102 abstracts or reviews. So basically the open search is just everything, and then as you check off more or use ways to focus in your search a bit more, then the open search only goes within those parameters.
I'm not sure that I understand the question correctly. Thank you for that, Kaelan. That clarifies running an open search, just selecting one of the keywords from the taxonomy. Now, if you're using the open search box where you typed in, say, diabetes, so if I type in the word diabetes and use a Boolean operator like AND, so I type in diabetes and home care, for example, I believe that we're searching all of the records in the database through all the full text of those articles. Is that right, Kaelan?
Correct. So the open search, as is, will get anything in the database, and then as you start to pick off different ways of focusing, whether or not you're doing primary care or any of the taxonomy, or reviews of effectiveness, for example, or different kinds of questions or different kinds of reviews, then each of those narrows down the open search. And you're right, Laurie, to say that the open search can also be used to get more specific within those taxonomies. So if you do nothing but leave everything open, as I mentioned with delivery arrangements, you get 1102 with nothing in the open search. So it just generates all of the records that come from an open search of delivery arrangements. Now, if within delivery arrangements you decide to type in diabetes and nursing, so you're using Boolean operators there, then the open search in that instance is used as a way to focus in specifically within the taxonomy you've checked off. So it's twofold. So in one way, the open search can be beneficial in that you want to learn everything possible about delivery arrangements, and another way you can use it to focus your search within those delivery arrangements. I'll pass it back to Laurie.
Kaelan. I see another question here. Open searches. Somebody asked a question about whether there's a fee for health systems evidence, and thank you so much for that question. There's absolutely no fee. This is free. It's funded primarily through research grants and through a grant from the Canadian Cochrane Centre. So thank you for that question. It's an excellent question. Again, the slides will be available on the Canadian Cochrane Centre website and soon uploaded onto Health Systems Evidence as well. I think I'll hand it back. I see that it's 1 o'clock, so I will hand this back to Adrian to wrap up. Thank you so much.
Thank you, Laurie and Kaelan, for leading us in this wonderful webinar. We thank you for your expertise, for your time in showing us how to use this tool. And they provided the URL, so please, folks, feel free to go ahead and use it. Tell your colleagues. And if you have any questions, further questions, as shown on the screen, you can contact Laurie, Kaelan, and Mike. Just before you go, we would like feedback from you on today's session. And so in just one moment, I'm going to load an evaluation form. And so if you can take the time to quickly fill that out, email it back to us at the Canadian Cochrane Centre, and the email address is provided on the screen. And as well as if you wish the slides, you can request at that time as well. Thank you to all of you for your time, your participation. What a great webinar that you've made it because of your participation. So I just want to thank you once again. Have a wonderful day, and we look forward to seeing you again right here with Cochrane Canada Live. Bye for now.